Mission Hospital is uniquely fortunate to have a psychiatric emergency triage or PET team available 24 hours a day, 7 days a week. The PET team was created to evaluate and initiate treatment of adult patients with behavioral health concerns. Clinicians are licensed and have had decades of experience in mental health. PET clinicians receive a handoff and attend the bed meeting to monitor for patients on one-to-one supervision with mental health issues, patients admitted for suicide attempts, or patients with current suicidal ideation, homicidal ideation, or inability to provide for basic needs to survive as a result of a mental health disorder should be referred to the PET team for evaluation. The PET team collaborates closely with the psychiatric physician consultants and other treatment team members. If patients are medically compromised and have behaviors that are interfering with care, the PET clinicians alert the psychiatric physician consultants that evaluation and pharmacological management may be warranted. PET clinician evaluations include assessment of biological, psychological, social, and cultural aspects of each patient. This can involve gathering important collateral history from family, outpatient providers, or others that are familiar with the patient. When a patient is medically stable for discharge from the hospital, if they have mental health symptoms that require further psychiatric care, the PET team clinician can help link to the appropriate level of care. They can provide referrals to outpatient resources, such as the county health services, partial hospitalization programs, or intensive outpatient programs. If a patient meets criteria for inpatient psychiatric hospitalization due to acute dangerousness to self, dangerousness to others, or grave disability as a result of their psychiatric condition, the PET team will perform a placement search by faxing the clinical packet to all in-network facilities and following up with phone calls to check on bed status. The PET team will obtain insurance authorization and complete transfer forms. If a 5150 involuntary hold is necessary, the PET team will write it and advise the patient and ensure that the original 5150 hold is in the transfer envelope. The PET team also arranges the ambulance transfer and helps to facilitate communication between providers for coordination of care. The PET team is a vital part of the mental health services at Mission Hospital. They are here for you. They help to triage and refer to appropriate mental health services not only at the hospital, but also in the community. You can reach the PET team in-house by dialing extension 7706 or calling them at 949-309-0063.